Joe Vipond, Dr. Joe Vipond, is an emergency room physician and the co-founder of Masks for Canada, and he joins us now from Calgary. Dr. Vipond, welcome. Thank you, sir, for your time.
Thanks for having me on. And before we start, I just want to say that the views that I present are mine alone and not those of the AHS or the Department of Emergency Medicine.
Fair enough, because that's what we want, are your views, especially around Alberta recording 600 new cases related to the variant of concern yesterday. And around this, the P1 variant identified in Brazil. Let's talk about this and how concerned you are.
Well, just look at the explosive growth of these variants. I think on Friday it was around 40%, on Saturday it was 50%, and yesterday was 63% of the cases. We don't know the exact numbers because we're not being given the exact numbers, but just eyeballing things, that's what it looks like to me. And so we have a doubling time of all the variants of about 6 days. And, exponential growth will bite you in the butt if you leave it alone. So we need to pay attention to this and act now, yesterday.
If we don't, what happens?
Well, it grows. And we know that these variants have a number of attributes that make them really dangerous compared to the original variant. We know that they're more transmissible. We know that they have higher impact on younger people, so younger people get sicker. We know they have higher mortality, higher ICU rates, higher hospitalizations. And this new P1 variant can reinfect people that have been infected with the original variant. So this collection of attributes make them extremely dangerous. They respond to the same things that the original variants respond to. We need to lock down. We need to close schools. We need to make sure that everybody's wearing the best quality mask as possible. We need to make sure people are distancing as far as possible, even indoors, because this is an airborne virus. And so we know what we need to do. We just need our leaders to do it.
So in your province, are leaders doing what you think they should be doing at this point?
Well, when you have a 5-alarm fire and your house is on fire, you can't say, well, let's just see how things go. We'll get the fire trucks out in a few days. This is, as physicians, we have made a pledge to protect our patients, health. And we have no capability of doing that in this. We know that these preventable and predictable illnesses are coming down the pipe. We know that people who are parents, who are grandparents are going to be made ill. Some of them will die. And all of this can be stopped if our leaders start to lead.
So at this point, when you say lead and take more drastic steps, should there also be, and we're hearing this from other doctors in other parts of the country, a shift in emphasis on who gets the vaccines, that rather than the elderly and those in long-term care that we have seen and that there was a need for initially, but now it's time to look at essential workers, both in terms of the vaccinations and in terms of protections. Where do you stand on that?
Yeah, I try not to weigh in on vaccine policy because, there's so many different nuances to this disease that to try and be an expert in all things is really, really impossible. But I know that there are still frontline workers in the hospitals that haven't been vaccinated. And I know that there are people that are being forced to go to work and don't have adequate protection. So if we're not vaccinating them, why aren't we giving them the best possible mask possible? Why aren't we teaching them about airborne precautions so that they can protect themselves? So there are multiple aspects to how to protect people.
What can you tell us about where hospitalizations stand at this point in your province?
I've been amazed at how flat they have been. I've heard rumors through the networks that they continue to be flat over the weekend, which is very different from what we're seeing in Ontario. But what I am hearing is that the hospitalization cases are much younger, and I'm hearing that ICU rates continue to climb, especially in Calgary. And so we know with exponential growth, we know that these are lagging indicators. They're about 2 weeks behind the actual case rates. And so we know that this wave of badness, this wave of impact on our healthcare system is coming. It's unavoidable at this point. And so the sooner we act, the sooner we can protect our system.
So you mentioned lagging indicators. So sort of a double-barreled question. What are you watching for in the coming days, and where do you think it could all be headed, say, a month from now?
Well, the leading indicators, there's three of them. There's the RT, the transmission rate. We now have the highest of the COVID-6, the provinces that have significant cases. Ours is 1.22, as calculated today by Ryan Imgrund in Ontario. We know that cases per day are a leading indicator, and they are exponentially rising. And we also know that the variant and the positivity rate has been bouncing around the top at 8 or 9%, which is the highest we've seen in months. So all three of those are very worrisome. And then you throw on top of that the variant percentage, which has been equally rising. So everything is indicating that we have a disaster that's on our doorstep. And, we as I keep saying, this was the predictable and preventable waves. This is also tragic because these are people whose lives are going to be impacted by this that have been done needlessly if leaders had followed the advice that they've been given.